My name is Fawn. Today's presentation, I'll be talking about the psychological effects of youth, homelessness, and evidence-based intervention strategy. Problem statement. Youth homelessness represents a critical public health concern with serious psychological consequences. Adolescents experiencing housing instability face relevant risks of depression, anxiety disorder, and trauma-related symptoms. Structural barriers such as poverty, discrimination, and limited social support worsen mental health outcomes. Introduction. Millions of youth globally experience housing insecurity. Contributing factors include family conflict, economic hardship, abuse, and systemic inequality. Relevance to social work. Findings can inform trauma-informed and housing-first practice, support development of inequitable social policies. Research question. In what ways does homelessness influence youth mental health outcome? Which intervention strategy demonstrate the great effectiveness? Literature review. Elevated rates of PTSD, depression, substance misuse among homeless youth. Trauma exposure strongly linked to long-term mental health challenges. Micro-level fracture. We have meson level fracture. We have micro-level fracture. Structural poverty, housing policy, and systemic discrimination. Quantitative components. Standardized mental health assessment. Qualitative components. Exploration of life experience. Theoretical framework. Individual level, trauma and mental health. Family level, support systems and dysfunction. A community level, resources and social network. Data analysis tools. Statistical regression to examine relationships between housing status and psychological distress. Practice implication. Why this research matters. Support integrated housing and behavioral health programming. Strengthen trauma-informed practice modeling. Informs policies reforms targeting youth homelessness. Culture, diversity, and operation. Racial and ethnic minority experience. Discrimination and systemic operation compound psychological stress. Ethical consideration. Voluntary participation with informed consent, protections of participants' confidentiality, trauma-informed data collection. Recommendations. Expand Housing First Youth Initiative. Integrate behavioral health service into housing program. Increase trauma-informed training for providers. Advocate for equitable housing policy. Projected outcome. Reduce psychological distress, increase housing stability, improve long-term life outcome. Conclusion. Summarizing key points, youth homelessness significantly harms mental health. Integrated interventions shows the greatest promise. Policies and practice reform are essential. Here are some references you can go through. Thank you for watching my video.